Today I talked about the presentation and treatment of both anxiety disorders like generalized anxiety, obsessive compulsive, overanxious disorder of childhood, and depression in children and adolescents. So separation anxiety disorder is the earliest childhood anxiety disorder, and that's when children, usually around kindergarten age or a little bit older, don't want to be away from a parent or caretaker, so that dropping them off at kindergarten, going for a play date at a friend's house, going to day camp or sleepaway camp become very difficult because the child does not want to leave the presence of a parent. Sometimes kids then have stomach upset, headaches, pains, or start crying and tantruming because they're too scared to be separated from their parent or caregiver. Generalized anxiety disorder is a child who worries about everything. That may be school, friends, parents driving home from work, sports performance, tornadoes, hurricanes, just worrying about a whole bunch of different things. And the worry is so pervasive, it lasts for 6 months or longer. It's hard to fall asleep. It's hard to do schoolwork. It's hard to go out and play and enjoy themselves because the worry is stronger than any of the good things in the child's life. And social phobia is anxiety and nervousness in social situations, whether that's giving a book report in school or giving a talk in front of a camera like I'm doing right now, or even meeting new people or talking to grown-ups who are in charge, like the teacher or the principal. People with social anxiety can't do those things, and so it gets in the way of functioning both at their job, which is going to school, and in their home and social lives outside of school. The first thing to do is to talk to their child about it and see if something's going on that might have made them more nervous. So maybe when they gave a book report at school they got teased and now they're nervous about doing it where before it was not a problem. The next thing to do is to bring it up with your primary care provider, your pediatrician or family doctor, to say, my son or my daughter is having trouble with anxiety, can we talk about it a bit at our next pediatric visit, and then explore that a little bit more. CBT in the anxiety triad is behaviors, feelings, and thoughts. So one example would be if I give my book report at school, everybody is going to think I'm silly and laugh at me, and so I'm not going to give the book report. So the first thing to do is to have them give the book report, and once they do that several times, the feelings and worries, everybody's going to laugh at me and I'm going to make a mistake, and the avoidance behavior, I'm not going to go to school so I don't have to do this, will tend to go down in severity. And so we usually work on the behaviors first, and then the feelings and the thoughts follow the behavior. I think the most important thing is that anxiety, number one, is common in childhood and adolescence, and number two, it's very treatable. Whether you're using medication or therapy, it is not something people have to suffer through in silence. We can help them get better and overcome their anxiety.